Good afternoon, students. So it is Wednesday now, and I am making you these videos as promised to finish up the exemplars we were supposed to finish up in class last night. We got through just a review of gas exchange and the lungs' role in that, and what gas exchange means exactly. We got through anemia and PE, and the last thing I want to do is go through cystic fibrosis and ARDS. This video is going to focus on cystic fibrosis, and if I can't get through all of it, then I will make a second video, but we're going to start just with defining it, and then we'll go on into nursing interventions, etc. So cystic fibrosis, what you need to know is that most people think about it as being only to the lungs, but it's actually a multi-system disorder. What's being affected here is the exocrine glands, or specifically, if you want to think about it, it affects the secretory glands. So anything in our body that secretes any kind of a mucus, or any kind of anything that secretes in our bodies is going to be affected. So if we think about systems that that secrete things, we have our respiratory system, we think of first and foremost because it secretes mucus. Digestive, we secrete enzymes. Skin, we sweat. And reproductive systems, especially in women, we secrete cervical mucus. So that's what cystic fibrosis is basically, and it's not an acquired thing. We're not able to reverse it. It's an autosomal recessive gene trait. So what happens is there's a mutation of the CFTR gene that results in a dysfunction of the CFTR protein, or an absence of the protein altogether. So why do we care about this? Well, this protein is responsible for controlling the flow of sodium and chloride in and out of the cells, specifically chloride. So without this, we get this overabundance of chloride and not enough sodium, or sodium is not able to follow chloride where it needs to go, and so we end up secreting a lot more sodium than we're supposed to, secreting as in getting rid of it. And so without the salt to give us a balance between sodium and chloride, we end up with these very thick secretions, whether they be respiratory mucus or cervical mucus, or whatever the case may be. As far as which gland we're looking at, it results in thick mucus. That's what I want you to remember about cystic fibrosis. Is first and foremost, it affects all secretory glands. Mucus is affected, and mucus gets really thick because of the absence of salt. So this shows a little bit more to this, that normally these chloride ions we have the protein kind of unlocks the door. It's a nice gentleman that likes chloride, and CFTR is very helpful, and he opens the door for chloride all the time. Well, if the protein's not there to open the door for chloride, to let it move outside and inside of the cell, then there's no place for the chloride to go. So it just ends up hanging out here and inside the cell, not leaving the cell, and we get this sticky, nasty mucus that builds up without salt. So it's as far as I don't know what I was going to say here. Put it here again. Okay, well, I guess just FYI, it varies by race. Gender's not a factor. But the one thing that I do want you to realize about this slide here is that the median life expectancy, so you can look up what median means if you don't remember what that means in math terms. The life expectancy is 37. This is actually really improved from what it used to be, because we recognize it, have early diagnosis, can supplement and educate parents about cystic fibrosis. I took care of a cystic fibrosis patient for many years when I worked on med-surg. She was hospitalized all the time due to poor care, and she died I think before she hit 20. So just because of not taking care of herself, and not having anyone to help care for her. So that being said, the more you care, the better care that these these babies receive, and so that'll be linked to economic factors, parents' ability, one, not to work, or financial ability to have caregivers, plus increased education and commitment to better, cleaner living environments. You will have a better life expectancy with cystic fibrosis. So when we think about that, that means that we still think of cystic fibrosis as being like a childhood disease, because it is, one, is diagnosed so early on, and two, because you don't really see people live that long when they have the disease. So just keep that in mind. Okay, so how is each system affected? Let's start with the respiratory system. So we always have a little bit of mucus hanging out in our lungs, and that's okay, and that's normal, because it can work to trap bacteria that makes it past our air filter of the upper airways, and it helps us move it up and get it out of the lungs. We need this. But in cystic fibrosis, this mucus is very thick and very sticky. And if you think about very thick, sticky mucus, yes, it's going to trap things, but it's not moving. It's not getting rid of that and moving it to the bronchial tree so we can get rid of it, because it's very thick and it's moving very slowly. And with this, then you just end up having this cesspool, or this breeding ground, kind of like after it rains and there's all the tubs fill up with water and stuff. It's a cesspool for mosquitoes, right? So you have to get rid of the water in order to no longer have that available for the mosquitoes to breed. And same thing here with all this thick, nasty mucus hanging out in the lungs. It's just a cesspool for bacteria, and many patients end up with pneumonia and chronic bronchitis because of this. So with that, if you look here in the notes that you're going to be provided with, you end up with chronic respiratory infections or chronic sinusitis, very susceptible to lung infections. Air trapping happens because if we breathe in, there's a little bit more force on inhalation, opening these alveoli, but then when we breathe out, the mucus can close up there, and we end up with air trapping in the alveoli. Well, if we've got air trapping down here, then we're not getting gas exchange, right? And then we also are not getting, so these alveoli then are kind of filled up like a balloon. They keep intaking more air, and they can't exhale the air that they need to. So then you have a hyperinflation, you get atelectasis, where they just collapse, alveolar collapse, maybe due to not getting any air in or out of them. Fibrosis, which means over time fibrin builds up, and then the lung compliance itself becomes very stiff, and we can't, the resistance is increased due to lack of compliance. We talked about that a little bit in the gas exchange review video. And then a destruction of the pulmonary tissue altogether. So, devastating effects on the respiratory system. Digestive system, how does this affect this? Sorry, it says click to add text, but if you look at it in the one view, it shouldn't have that. So remember that our pancreas, when we talked about pancreatitis, we talked about how the pancreas secretes all these enzymes. Well, remember that this disease is affecting the secretory glands. So the secretion of all these pancreatic enzymes is not going to happen very well. And if we don't have enzymes, just like with pancreatitis, with it being blocked off, you end up with GI issues. And same thing happens with children with cystic fibrosis, or anyone with cystic fibrosis. You don't have secretion of the enzymes to help break down. Remember, proteins, cholesterols, and fats are what's broken down by these digestive enzymes. So with that, you have poor absorption of nutrients. So these children can have failure to thrive. They can end up with all these different things: intussusception, malignancies, abscesses, constipation. The one gal that I saw was actually in more so not for respiratory issues, but more for GI issues, because she didn't have the money to get pancreatic enzymes, because you can administer these as medications and it helps a lot, but she didn't have that, so she was in all the time with bowel obstructions because she didn't have any enzymes to help break this down and move the food through. So and then again, we might have fibrotic changes. So Again, we're seeing that part of the name cystic fibrosis due to these thick, nasty secretions. And this can cause the development of type 1 diabetes. Remember, too, that when we talked about pancreatitis, another thing that happens was that the patient's glucose or triglyceride level shoots up. And same thing happens here, is that due to that prolonged over time, we can have changes in the islet of Langerhans, and then we can have the development of type 1 diabetes. So the first sign, this is very important you know this, the first sign that you might see in a newborn is meconium ileus. Look that up. You can probably guess. Ileus means like no movement, and remember that babies at first, newborns, they don't have stool, they have meconium. So look that up. That's basically they aren't going. That's going to be your first sign in a newborn, like after the baby's born, that they have cystic fibrosis. And then along with the GI issues, the constipation, the intussusception, the meconium ileus, GI or bowel obstructions, you can have development of Crohn's disease and all these thickened biliary secretions too, because the biliary ducts are also infected. You can affected. Sorry, you can also have a lot of gallbladder disease and liver dysfunction. So again, this is a multi-system disorder. It affects every aspect of your life, and in anything that secretes anything. The secretory glands are all affected. So then here we see in the effects on the integumentary system. One of the things about their sweat is that it's very, very salty, because again, we're getting rid of too much salt because of this mismatch. We don't have that nice gentleman CFTR opening the door for chloride, and then sodium is chloride's best friend, so it follows chloride around, and we don't have that. So when they sweat, they lose excessive amounts of sodium. Keep that in mind. Excessive sweating, excessive sodium loss. And then the reproductive system. Two things happen. First of all, I know this might gross some of you out, but this is just how this is. It is what it is, as my mom used to say all the time, which I hated, but whatever. This is cervical mucus. And many people that engage in natural family planning or do not take birth control test their cervical mucus. And when cervical mucus is really thick like this, that means that the body is saying, like, we don't want sperm up in here. If you have sperm, we're not going to move it along very fast because we're not ready to take this sperm and to fertilize an egg. So in that part of a woman's reproductive cycle, she has very thickened cervical mucus. And then the thinner it gets, the more willing it is to move sperm along. Kind of how the lungs will move along foreign bodies so long as it's nice and thin. But when it's thick, it doesn't do that. And same thing here. So if you think about that, if cystic fibrosis causes all these thickening of mucus, then we're going to have a thickened cervical mucus and all the time. And it's not going to want to move sperm up and fertilize the egg. So many women with cystic fibrosis have a lot of trouble getting pregnant. And then one of the major causes here that we see, and it's written on the slide, of congenital bilateral absence of the vas deferens is because of cystic fibrosis. So many males can also be infertile due to cystic fibrosis. So remember, really quick here, that each symptoms, they correlate to the affected system. So think about thickened mucus and where you have mucus, where you excrete salt, like the skin, or water that's going to have sodium and chloride in it, and what do you think is going to happen to that? So this is, again, just a list of symptoms are down here. The things that I want you to know the most is early on, how are we going to catch that? And that's going to be the meconium ileus, the stools, and then they're going to also have changes in their chest x-ray due to the respiratory issues. Okay, so that's it for this video. I'm going to make a second one finishing up on testing and nursing interventions, okay?